Good evening, prostate cancer advocates. Welcome to Prostate Cancer Advocacy at Home. I'm Ali Manson, the Vice President of Government Relations and Advocacy for Zero. I'm joined tonight by my colleague Susan Sweat from Cornerstone Government Affairs, as well as Hal Berger and Georgia Bates from the Zero Government Relations and Advocacy team. And we are here tonight to talk about things that you can do in your hometowns without coming to DC over the next month or so, but especially actually really year round, in order to have an influence on prostate cancer policy. I want to kick off just by giving everyone a warning and a pre-apology. There's a fairly large storm here in the DC area right now. So if we lose power and internet, we will do our best to get back on as quickly as possible. And we built some redundancy in Texas with Georgia. But I just want to start by saying Mother Nature is just here to surprise us, like everything else right now. You might have been following the news. You might have been following our blog, The Prostate Policy Pulse. So you might have an idea of all the many things that have been happening in healthcare policy, in Washington, D.C., in politics over the last couple of months. And our hope is that now we can kind of return to our regularly scheduled programming for a little while, at least, until the next interruption. So we will start with Hal, if you can go to the next slide. Taking some time tonight to talk about the fact that we've got a district work period coming up. In case you hadn't heard, August in DC is kind of a miserable, muggy time of year. So since the very beginning, Congress has gone home for that month. They go back to their districts. They are able to have meetings with you without you having to get on a plane, right? They're going to fly your way. So it's a wonderful time to keep building those relationships. And hopefully at the end of this hour, you'll be ready to schedule and conduct those meetings all on your own. Next slide. In case you have not been on one of these webinars or really any webinar we've done before, consistency and persistence. Those are the two things that we really care about. These relationships that you form with the people who represent you make it easier for you to make those asks in the future and to keep having an impact year over year, month after month, year after year in DC, because you're a known quantity, right? So you see them in DC, you see them at home, you send an email, you make a phone call. All of that kind of builds to that relationship that you want to have long-term with your elected officials. Next slide, please, Hal. So this is hopefully pretty simple. You're going to request a meeting. You're going to prep for that meeting, and we're going to explain what you need to do for that later in this webinar. You will show up. You will make your ask, right? You're going to tell the folks you meet with, whether that's a member of Congress or their staff, what it is that you want them to do, right? What it is that will make things better for prostate cancer patients or for those at risk or for those who care about them. You're going to send a thank you and any necessary follow-up. And then please, please, please tell us how it went, right? We want to know what you heard. It helps us to do our jobs better, and it allows us to do any follow-up you might have needed, right? If there's a question you can't answer, well, we'll have someone at Zero follow up with you. So you let us know how it went, and we can make sure to close any needed loops. Next slide, please, Hal. And I'm going to also caveat right here, if you need to ask a question, please use the Q&A function at any time. Add stuff to the chat. We're happy to pause, redirect, answer questions, and we'll be popping some links in the chat as well that will be helpful as we go through this. So I'm going to welcome Hal Berger on our GR and advocacy team. I think many of you know Hal from the summit, but he is going to walk through how to request a meeting. And of course, if you have any trouble, you're going to follow up with Hal. Shoot him an email. He's very happy to help.
Okay.
Hal, take it away.
Thank you, Ali. So now that we have gone over the why, we're gonna go over the how. So everyone who's watching this right now, you have an advantage that me, Ali, and Susan don't have. You are all constituents, which means that you have unique access to your other members of Congress. So, how do you request a meeting? It's actually very straightforward. Your member of Congress has a website, and somewhere on that website, there's a form to request a meeting. It may look a bit different from office to office, but they are generally pretty similar across the board. Usually how they can be found like under the contact tab or the request a meeting tab. You may have to search for it a little bit, and then just fill out the form as you can see in this short little video over here. See like it has I did record myself. A request a meeting. There's a drop down for the type of request, and then in the location in the district, the date, the number of the attendees, et cetera, et cetera. So again, it's very straightforward. You just fill out the information, it gets sent over to their office, and then they'll get back to you. And then once you submit that form, please let me know, just so we can be tracking every meeting that's happening, and also we can offer assistance if need be. And, and, and again, as Ali said, if you're having any problems whatsoever, just email me, and because I'm way too available, so just please let me know. And I see there was a question in the chat. Oh, um, Ali just dropped into the chat a very easy link to go and find your representative. And then I also want to mention every congressional website has the list of offices on there. So as you can see here, for Congressman Bobby Scott in Virginia, he has one office in DC, which is his main office for legislative affairs. But he also has a local office in the district. So if you're in Bobby Scott's district, you would be going there for the meeting. And then also in some members of Congress also have multiple offices across the district or state, depending on the size of that district. And and again, once you have scheduled the meeting, please let me know, because we may have some important information for you. So it's just important to go and make sure how we're in the loop because again, like if this because we could because just in case how this member of Congress is like head of a committee, we should know just so we can give you a little extra of preparation, so you're doing the best job possible. And now we're gonna go onto the preparation part, which is what are your asks? And I'm gonna pass it off I'm gonna pass it back to Ali.
Thanks, Hal. Yes, preparation, everybody's favorite, but I'll pause really quickly and just ask if anyone had any questions or concerns about how to request a meeting. It should be pretty simple. And actually, if you go to our website that I think Hal can drop in the chat for advocacy at home, it gives you even some sample text for what you could put into an email if that's easier. But you're just going to say, hi, I'm so and so, I'm a constituent, and I would love the chance to talk to you about how you can help prostate cancer patients while you're in the district in August. Is there a good time? Right? It's friendly, it's easy, I promise. So moving on to what you want to ask for, right? We have a number of priorities at any given time, but we're going to focus on two for the rest of the summer. These are two that right now is a really important time to be able to have an influence on the process. I think everyone probably knows that the prostate cancer research program is really important to Zero and it's really important to the prostate cancer community for a number of reasons having to do with the schedule of the appropriations process this year. We're probably not going to have a ton of impact on that if we do meetings in August. The precision oncology program in the VA is something that many of you have heard about. Also, probably not the ideal time and way to have meetings in August. So we've got two issues that we really think it's possible for meetings that everyone here has in their own districts to be meaningfully impactful in the process at this time, right? We want to use your time well, and we want to have an influence on policies that are important to us. So we're asking our lawmakers for two things. First, we're asking them to support the work of the CDC's Division of Cancer Prevention and Control. That is that foundational public health work. It's registries, it's overall state funding to do cancer control. It is screening and awareness programs. And then it's co-sponsoring the PSA Screening for Him Act. That's now kind of an oldie but a goodie. Everyone's familiar with it. But the committees that are responsible for the PSA Screening for Him Act have been really busy with reconciliation legislation for the last few months. and now they have free time, sort of free time. And so we want to make sure that when they are wondering what to do with this new time, they are able to say, oh, that PSA for him bill, I've heard a lot about it. So we're going to build up the co-sponsors for PSA screening for him. Next slide, please. And I'm going to talk a little bit about the CDC, and then my friend Susan will have a chance to talk to you about PSA for him. The CDC is many things, but it includes something called the Division of Cancer Prevention and Control. That is a small staff that does a specific set of cancer-related activities. It collects data on cancer cases and treatment. Actually, Hal, if you can keep clicking, I think some stuff's going to pop up while I talk. That's the cancer registries. It funds states to prevent and control cancer. That's the Comprehensive Cancer Control Program. It provides screening diagnostics at low or no cost for breast, cervical, and colorectal cancer. And it helps educate people about cancer, including a prostate cancer resource center and a number of other prostate cancer educational tools. Next slide, please. These are kind of your core public health work, right? That is information, it's data, right? It's information that helps us to know things like what's happening with cancer rates. We know that the rate of metastatic disease at first diagnosis has gone up in recent years. We know that because of data that comes out of the National Cancer Registry Program. In fiscal year 2026, the president's budget request proposes to eliminate the National Center for Chronic Disease Prevention and Health Promotion, and that includes the DCPC, right? So it includes all of the cancer programs that CDC runs. Now, the president's budget request is just a request, right? Congress decides whether or not to continue funding for those programs in the appropriations process, right? They will hold hearings at the subcommittee and the committee level. They will make decisions about how to spend that money in the House and the Senate. They will find compromise in conference, and they will actually decide, right? The president proposes and Congress disposes. They get to decide what actually happens with the money, but it does matter what the president's budget proposes, right? That is essentially the administration's opportunity to say, this is what we think we need and don't need. So much of the money that comes through the DCPC goes back out to state health departments. The cancer registries, that's actually money that goes to states in order to add their data to registries, in order to operate their parts of the registry. Some states will try to make up for that money, right? If they lose CDC money, they will try to find new money. But the fact is, states actually have to balance their budgets. And states don't have nearly the budget the federal government does. So many of them will not actually be able to fill the hole left by CDC's cancer funding. So that funding does everything from cancer registries, which I will say over and over, because without a registry, without that data about the trends and patterns in cancer, we don't know what to do, right? Our Blitz the Barriers Project initiative that everyone here has heard about, I hope, is targeting 12 high-risk communities around the country. We know which communities to target because of registry data, right? Because we can see where rates are higher. We can see where disparities are greater. We can see where the stage of diagnosis is less favorable, right? We can see all of that data because of the programs operated by CDC. There's also the state cancer coalitions. Every state has a cancer coalition who they are a multidisciplinary entity within the state. They're made up of organizations, physicians, patients, local nonprofits, right? All the folks kind of working in the space in that state, and they target what their specific needs are, right? So they're able to look at that data and say, what do we need to do in order to improve outcomes from what cancers in our state? The National Comprehensive Cancer Control Program at CDC provides funds, it provides guidance, and it provides technical assistance for those coalitions so that they can actually do the work in the way that they see fit. That's money that goes to all 50 states, it goes to DC, it goes to territories, and it goes to 7 tribes and tribal organizations. It is not a lot of money in the federal budget, but it's a lot of money in a state budget. Next slide, please, Hal. I just really want to drive home this piece about the registries because that data just drives everything. So if you look at This little line on the right-hand side of your screen, that is a timeline, right? Showing cancer diagnosis rates over time. Anyone here think that they can pop in the chat saying what they think that dip is around 2020? Right? It's the pandemic. We saw a drop not in actual cancer, but in cancer diagnosis because we saw a drop in cancer screening because people weren't being screened, right? They weren't going to their regular source of care. Um, exactly, Darnell, right? It's COVID, and not because there wasn't cancer, but the data really is what we use to tell the story and to understand the impact of outside events and what's happening in the world around us. So CDC, if you're a data nerd, and even if you're not, it's a lot of fun. Check out their data, their cancer statistics data visualization. It's really cool, and it can tell you a lot that you might not otherwise have known, and that really helps to illustrate this story. Next slide, please, Hal. So our ask is pretty simple. We want Congress to maintain the work of the DCPC, right? These programs, this collection of programs is incredibly important. You'll notice we don't say it has to be funding for the DCPC. It says the work of the DCPC, because the truth is the way this administration is approaching health, there is included in that president's budget proposal the creation of a new agency, the Administration for a Healthy America, that is intended to address chronic disease. And they are talking a lot about how the CDC is going to refocus on infectious disease. The truth is, if they wanted to move all of these cancer activities over to a new agency focused on chronic disease, but the work continues, we can live with that, right? What we care about here is that the work gets done, that the data is available, that the support for those cancer programs are available, the cancer coalitions are available, that all of the work that's been done around prostate cancer education and awareness, the Prostate Cancer Resource Center, that all of that is still available for the individuals and the communities who rely on it, right? That is just absolutely foundational information for the fight against cancer. So we want Congress to maintain the work of the Division of Cancer Prevention and Control at CDC. And we're going to go to the next slide, and I'm going to hand this over to my friend Susan Sweat and take a moment to breathe.
All right. So we have, we thank you, Ali. 2 requests for y'all to make in your meetings in August. One is that CDC funding, preserving it in whatever form, wherever they want to put it at HHS, but just making sure we still have our cancer programs there. And the other thing we have is a piece of legislation that we are really optimistic about working its way through the Energy and Commerce Committee in the House and through the Health, Education, and Labor Pensions Committee in the Senate. In fact, I just came from a meeting with Energy and Commerce, and they were asking me about our bill and when they could get it moving. So this is a very timely request for you this August. We are trying to get more members of Congress to co-sponsor this legislation. Co-sponsoring means that you're lending your name to a piece of legislation, basically endorsing it and asking, and by endorsing it, it improves its chances of moving through the legislative process. So we've got our committee geared up, and what they're looking for is a good number of members co-sponsoring our legislation. So we're very excited that they seem very willing to take up the legislation. Our challenge now is to get enough members to co-sponsor. So you are going to be extremely helpful in that effort if you can do some meetings during the August recess that will result in those members co-sponsoring our legislation. So the PSA for Him Act, you all know what a PSA is. The PSA for Him Act is a piece of legislation that removes barriers for screening. Well, we know that screening is incredibly important for prostate cancer, right? Because we have no symptoms in early stages of prostate cancer, and our early stages are the most treatable. We know that if we catch you in stage 1, we have a really great survival rate. But if we catch you in late stage metastatic disease, our survival rate plummets. So we want that screening to be done early and often. And PSA testing is our best screening tool that we have. And that's where we get the majority of our cancer diagnosed from, is starting with a PSA test. And you know that this is a simple blood test. And that's what we want you to go in and talk to your members about. how easy this blood test is and how it can help you know what your risks are for prostate cancer and whether or not you need to take the next step for diagnosis or treatment. We are trying to get more men to have their PSA test done, and right now, eliminating the cost share. That's the co-insurance or the co-pay that you might have for your insurance. We want to eliminate those for men who are at the highest risk of prostate cancer, right? So if you have your insurance through your employer or you buy it on the marketplace, that's who we're talking about. And we want this blood test, this PSA test, to be included in your annual physical, just like your cholesterol and all these other things that they draw a little bit of blood for and check a box on. We want men who are at high risk to have that included in their annual physical without any cost, without any barriers to getting that done. Next slide, please, Hal. And so our bill is very targeted. It says that the men at the highest risk, that is Black men and men with a family history of the disease, so they have a genetic predisposition or a family history of a prostate cancer or an associated cancer. We want those men to not have to pay copays or co-insurance, any kind of cost sharing, in order to get their PSA covered by their private insurance. This is a really great piece of legislation. It has no cost to the federal government. The DOD, the DOD and Medicare already cover PSA tests, right? So those are the places where you would see costs to the federal government because the federal government pays for those. In this case, we're talking about private insurance. There is a federal regulation that says if you have this kind of rating, these things aren't covered. These things are covered without copays, and it requires private insurance to cover those. This is our legislation would be a rifle shot bill, really small and narrow, and require that private insurance cover the PSA test for men who are at most risk for it. This is very similar to what exists for breast cancer screening. So breast cancer screening has had a lot of different recommendations over the years, but women have never felt the difference in the recommendation because Congress went in and said, no matter what, private insurance, you have to cover mammographies. We want Congress to come in and say, no matter what, you have to cover PSA tests for high-risk men. So we have precedent in breast cancer. We have no cost, and we have a bill that the committee is ready to move. Your task is to try to get your member of Congress to co-sponsor or endorse our bill. Next slide, please. So this kind of summarizes, right? Our cost sharing is just one more thing that keeps men from getting diagnosed early and saving their lives. And we know that this is a very simple and easy tool that we can give men to help them get closer to earlier diagnosis and save more lives. The bill has been introduced in the House by Neil Dunn, a urologist doctor, now a representative from Florida, and Yvette Clarke, one of our leading advocates in the Congressional Black Caucus from New York. Both of them sit on the Committee of Jurisdiction, the committee that handles this bill. And then we have Senator John Boozman and Senator Cory Booker, Boozman from Arkansas and Booker from New Jersey. And so they have introduced the bill, and our goal is to get as many people as possible many members of Congress as possible to co-sponsor their legislation. We'll, of course, be giving you handouts to provide in your meetings, but in the chat, I put a link to the members of the Energy and Commerce Committee. What we believe is the best path forward for us is to start in the House, get this bill passed in the House, and then lob it over to the Senate and have them take it up. And the Energy and Commerce Committee is the committee that really controls our destiny in the House. So if your member is on the list that I just put in the chat, you are doubly important because those members can really push forward our legislation. So if you're on that list, we really, really want you to go in there with a lot of confidence and excitement about the legislation and hopefully explain to them how impactful they can be on making sure that high-risk men actually get a PSA test to potentially save their life. All right. And then I think Hal's put in the chat the list of members who have already co-sponsored, endorsed the legislation. So if your members on that list, you're just saying thank you. You're not having to ask them to do it again. They've already added their name to it. And so you certainly want to thank them for that. And members really rarely get a thank you. They always get people coming to them with a problem and hardly ever somebody coming in and saying, thank you for doing the right thing. So if you have a member on the list that is already co-sponsored, we still want you to take that meeting. We want you to talk to them about the CDC and thank them for co-sponsoring our legislation on PSA for him, and tell them how important lending their name to this is. They will walk away feeling better about your interaction than anybody else's interaction that day, because they really are trying to do the right things for their constituents. All right, so next slide. Here's what we do in a meeting.
Thanks, Susan. I think everyone has, hopefully none of this is a surprise, right? We're going to show up a little bit early, but not too early. You're going to introduce yourself. You're going to say where you're from, right? Because that's your kind of, yes, in fact, I am from here. I am, in fact, your constituent. And we're grateful, right? We're always grateful for people's time. You really want to start with your story, though. And if you want to level up, you're going to share your story in a way that kind of fits into the asks, right? So, I am one of the, higher percentage of people who were diagnosed with advanced disease at first onset in the last few years. Or I actually hadn't planned on getting screened, except that a family friend insisted, and then I had to convince my doctor, right? Or whatever it is that kind of connects your story to that cancer prevention work at the CDC, which I will say is harder. It's a lot easier for folks in the breast, cervical, and colorectal cancer spaces because they actually have specific screening programs. But it's a little easier, I think, for most people to talk about their screening experience and how a PSA test identified their risk relatively early, or how they wish they'd had the PSA test earlier. But then you're going to make the ask, right? You're going to tell your story, and then you're going to ask for what you want. The easiest meeting for a member of Congress is the one where you get to say, where you've said thank you and they're just, magnanimous, or the one where you never really make the ask, right? You tell the story, you kind of hang out, but they don't have to disappoint you. They don't have to make a hard decision. They just kind of get to make you feel good and have everybody walk away. So make that ask. Don't expect an answer, right? Unless you met with the member, in which case the member can say anything they want. But if you're meeting with staff in particular, they usually have to go back, right? They've got to talk to their boss. They've got to talk to other people on their team in order to make a commitment to a legislation. So make the ask, but don't necessarily expect a response right now. Thank them again and head on your way. Next slide, Hal. And as soon as you leave that meeting, I'm going to say, even before you send this thank you note, start with step 2. Send us a report about your meeting and let us know if there's any follow-up we need to complete or anything else you need, right? Maybe you promise them an extra piece of information. You can send that thank you note with some extra data we've gotten for you, the electronic versions of your leave behind materials, which can be found back at that link, Advocacy at Home, in the chat that Hal shared earlier. But send that thank you note, send all your follow-up, and make sure you let us know what happened. That's just tremendously useful. And if you've warned us ahead of time, hey, I'm meeting with so-and-so on this date, we'll probably follow up with you too if we don't hear from you afterward, just to see how it went and what else we can do to support, right? Because we want not just to have these meetings, but then also to really make sure that we capitalize on the conversations you had in order to achieve our goals. Next slide, please, Hal. So what about the rest of the year, right? This is August. Congress will be home in August. There's actually a number of district work periods throughout the year where they'll be back in your districts. But all the time, your state legislators are at least closer than DC, right? Maybe you're in Texas, maybe Austin's pretty far. But if most of the time, your state capital is closer to home than DC, and you can meet with your state legislators. So I want to briefly introduce Georgia Bates on our team. Georgia handles all of our state legislation, and she's going to talk a couple minutes about what you can do at the state level all year round.
Thanks, Ali. So as you can see, we have a few things going on in state advocacy right now. There's about 7 states that are still in session, but are on summer adjournment. So they're still taking district meetings. It's still a great time to meet with legislators because they're a little bit on their off season. So you can catch them before they start cooking up ideas for legislation. So those states that are still active, it's Arkansas, Massachusetts, Michigan, New Jersey, Ohio, Pennsylvania, and Wisconsin. So Zero has helped pass a state version of the PSA for Him Act in Virginia this session. And we also passed a bill in Vermont that required insurers to cover prostate cancer screening. So I saw John Glass on this call. Thank you for everyone in Vermont and Virginia that helped with those efforts. But there are still bills ongoing that we're working on, including several versions of the PSA for Him bill, which covers and cuts costs for prostate cancer screening. So those bills that could pass this year are in Ohio and Pennsylvania, and bills that are being reviewed this year in order to be reintroduced next year are in Maine and New Jersey. So we're also working on a biomarker testing coverage bill in Massachusetts, and bills were passed in Connecticut, Nebraska, and New Jersey to provide biomarker testing coverage. And then also there's a medical debt relief bill in Pennsylvania we're working on currently, and we've passed medical debt relief bills in Virginia, Vermont, and Maine this session. So when the next session begins, next January, there'll be 46 states that'll gavel in for session. And so Zero will have more opportunities for advocates in all different types of states to engage through meetings, testimony, recruiting in-state advocates and partners, doing these campaigns, media engagement, capital events, et cetera. The way Zero chooses states is partially based on the health needs of the state population, but it's also based on the likelihood of bill passage. And that all depends on what advocates do from now until January, as was the case in Georgia with Derek Holloway, in Alabama with David McElhaney, and in Maine with Paul Lewandowski, all who convinced their legislators to introduce legislation to cover and cut costs for prostate cancer screening. So a round of applause to you 3. I hope there's many more next session that convince their legislators to file this really important bill. And just pointing out that your odds convincing a state legislator to file legislation, it's much higher because they have about 1/7 of the amount of constituents compared to a member of Congress. So you're not competing with as many people, maybe competing with 1,000 or so people compared to hundreds of thousands in a congressional office. Hal, next slide. I've listed all of our active campaigns for advocates, and you can see which campaigns you should fill out based on the state you're in. So for the no-cost prostate cancer screening campaigns, the 3 active campaigns are New Jersey, Ohio, and Pennsylvania. But if you're in another state outside of those 3 states, you should fill out the all other states campaign listed there. And I'm going to walk through that campaign and how to do it, both for first timers and for advocates who have already filled out a campaign. I'll also flag that we have a Support Medicaid by Sharing Your Medicaid Story campaign that is live. We're going to be focusing on Medicaid in the states. We're going to see how much funding we can offset for different programs that are funded by Medicaid, Medicaid fund services like cancer screening and treatment. So we want to keep organizing on that. And then there's a link to ACS CAN's campaign for the Massachusetts biomarker testing bill that's still being advanced. All right, I'm going to try and share my screen. I'm closing out my other tabs and I'm saying a deep prayer that this works. Let's go. All righty. So this is our campaign for no cost prostate cancer screening legislation, or the PSA for him state bill. And this is your campaign you should use to try and bring that bill to your state. So if you've never filled out a campaign before, you should see this form blank at the top. There's instructions for first timers down here at the bottom. So the first step, fill out your information at the top. So fill out my email, first name, last name. And very important, you have to fill out an address, make sure you click it, because that is how we identify your legislators and who we should send these messages to. So we also ask you to fill out these two just identity markers, giving a little bit of background to your connection to prostate cancer. You can choose to opt into text alerts, but you'll see here, based on the address information I entered in, it is already sorted out who my representatives are. And so with the information you fill out in this form, it'll fill out the name of your state, it'll fill out your name at the bottom. But the cool thing about this is you can directly edit this copy and insert your story. And so a few things I recommend including: how early detection has impacted your loved ones' lives, how cost-free early detection in this legislation would impact you or your state. And I also include different sample patient stories that have been used that have been pretty successful. If you have any questions about how to frame your story or want assistance in that field, please email me. I include my email on the PowerPoint slides. So if you do want to type a message saying, I was diagnosed at age 45, et cetera, et cetera, et cetera. And you click save, and then it'll autofill the rest of your messages. And then you will click sign up to submit the message. And then you should see this screen that says thank you. And that is how you know the message has been submitted. Now, if you are a returning advocate, you are going to see something like this. The system will recognize that you are logged in and your legislators have already been brought up along with your name and your information. So a little bit easier, you don't have to fill out the form. However, if you do want to personalize the message, you still have to go down to the bottom, click the pin icon, type your message, be sure to save it, and then click submit to send the message. Do I have any questions about what I just walked through? Thank you for bearing with me. I've gotten tons of emails of questions about why is the interface different for this person I just shared the campaign with, but not my own. If you're seeing something different, it's probably because you're an expert and you probably know what you're doing. But for first timers, we want to clarify it'll be a different interface you'll see.
Technology fun, but it's easy, I promise. You can also, if you click on an action alert that tells you to make a phone call, it'll actually call you, and all you have to do is answer the phone, and then it will connect you to the offices that you're calling for, and you'll just use the talking points that are on the screen where you clicked the button. So it's really, really easy, I promise. So we want to pause. Hal, I think the only remaining slide we have is about questions, right? There we go. So we can even pull that down and see if folks have questions here. And maybe I'll start by putting out a challenge. If you are finishing this webinar and thinking to yourself, yes, I'm going to get up tomorrow morning, I'm going to look up the request a meeting function on my legislators' websites, and I'm going to schedule that meeting, go ahead and use that hand raise function. I want to see how many hands we can get raised, because I'm hoping it's everybody. There we go. If nothing else, people are figuring out how to use the hand raise function, which I also love. That's fantastic. I know that number is going to keep going up. So thank you. This is a wonderful way. I mean, I cannot say enough times how incredibly productive it is to have that meeting back at home. So if you have any trouble, call us. Hal
Can
is
I,
free all the time. This is all Hal
Allie,
wants to do for you.
I just want to jump in and say, I mentioned earlier that I was just with the Energy and Commerce staff and I had to leave and come do this. They said, and they were like, why are you leaving? What are you doing? And I was like, oh, I'm doing a webinar with Zero. We're going to do August meetings, district meetings. And they were like, oh, that's really good. Those are the best meetings to have. And I said, yeah, we're going to get that bill moving by having these August meetings. So just straight from the hill, they agree that when you do these meetings with your members back at home, where they don't have the chaos of DC, and they're talking to someone that's from their state, from their district, it's just like them, that they are in charge of representing in Washington, DC. It's very impactful for them. It gives you a really good quality meeting, and we know it's very impactful up here in DC. So thank you guys so much.
And we want to open it up for questions. To answer that first question in the chat, yes, we are going to send around the slides and recording. We'll also send the link to the Advocacy at Home webpage, which will have the recording on it eventually in a day or two, probably. It also has those template language for an email. It has the links to the one-pagers, right? Because you want to show up for your meeting in person with 2 printouts, 1 page each. I promise they're not even front and back, that just kind of really simply lay out the CDC cancer issue activities and PSA screening for him. So they'll just be nice little things you can hand over when you walk in, and email again when you follow up, right? It's nice to have things both in hard copy and in soft copy. So we will share all sorts of materials afterward. Feel free to share those with your friends and family, right? They couldn't be here. That's just fine, right? They can catch up. And again, anybody who needs help, reach out. I'm going to volunteer Hal. Keep him busy. He does not have enough to do tomorrow. And what he really needs is an onslaught of emails and phone calls asking for help getting meetings scheduled, or just telling him that you're scheduling a meeting. That would be fantastic. It would make his day.
And it will help us a lot, because when you have those meetings, we are going to follow up with those members and their staff up here in DC and say, hey, your boss met with this constituent back in August, and really nudge the DC staff to do follow up with their boss to make sure they're taking the right action on this. So we do need to know who you're meeting with. That helps us a lot.
We're here for a tag team approach, right? Mm-hmm. First us, then you, then us again. We're just going to keep going until they're so tired of us, they say, yes, anything you want, please go away. Just like,
I always say every no gets us this much closer to a yes, right? They can't say no forever. They want to do things for you. They really do. They're there to represent you, and they take it seriously.
All right. I am not seeing more questions coming in, which tells me that we were fabulous at this tonight, and that y'all are just either have already read all the materials, have already heard us talk about this too many times, or we're just really impressed by the content you got tonight. So we're going to take our wins when we can get them. And just a reminder one more time, our asks are supporting the work of the CDC's Division of Cancer Prevention and Control and co-sponsoring the PSA Screening for Him Act. And if you remember all the other details, that's great. But if all you can do is say, here's a one-pager, here's my story, here's what we want, that's okay too, right? That'll get the job done. So thank you very much for your dedication to this work, for being our partners in this fight. And we look forward to talking about our successes in September. We'll celebrate them in Prostate Cancer Awareness Month. So thank you very much. Have a great night.